Hello and welcome to our Introducing Solids workshop. This workshop has been created by the 0 to 19 Growing Healthy team in North Yorkshire. You are able to pause, rewind or re-watch this workshop as needed. By the end of the workshop, it is hoped you will feel more confident when weaning your baby from 6 months and beyond. Introducing babies to solid foods is often called weaning. It's a gradual change that your baby makes from having breast milk or formula milk to having solid foods. In the beginning, your baby will need to learn the skills of taking the food into their mouths, chewing and swallowing. At this stage, foods are not expected to take over from the milk, but to complement it. They are still getting most of their nutrition from milk at this stage. In time, as your baby gets used to the idea of eating, their diet will gradually become more varied. By doing the same thing every day, your baby will learn that when they go into a high chair, they're going to get some food. All babies are different and some will enjoy food from the beginning, whereas some may take a little more time. So be patient and enjoy it. There is a lot of conflicting advice about everything we do with parenting, but the Department of Health and World Health Organization guidelines state that the latest research shows that babies can get all the nutrients they need from breast milk or first-stage infant formula until they're around 6 months old. Before you start weaning, you're going to go and get some equipment. So first of all, you'll need a high chair. This will enable baby to sit upright. Your baby needs to be sitting safely and strapped in an upright position so they can swallow properly. Never leave baby unattended on a raised surface. Next, you will need a first cup, so a free flow feeder cup, one without a valve. Just like we have a drink with meals, a babies will need to do this too. A baby needs to learn the skill of drinking from a cup, so encourage your baby to sip water from a cup with their meals. Open cups or free flow cups help your baby learn to sip, and it's better for their teeth too. Cups with a valve mean it is more difficult for your baby to drink as easily. Spoons, soft weaning spoons, usually the ones made of rubber or plastic, are easier on babies' gums. Plastic bowls, ideally the ones with a suction base, otherwise things are likely to end up on the floor. Bibs, anything that's easy to clean. Plastic or pelican bibs are best in the beginning. A messy mat or a large plastic cover, or even newspaper under the high chair can be handy, as babies, like we said, can be messy eaters. Ice cube trays, very useful for batch cooking and freezing smaller portions. So how do we know when it's time to introduce solid foods? The recommended age for starting solids is around 6 months. Every baby is different, but there are 3 clear signs which altogether show that a baby is ready for solid foods alongside their usual breast milk or infant formula. 1, they can stay in a sitting position and hold their head steady. 2, they can coordinate their eyes, hands and mouth so they can look at the food, pick it up and put it in their mouth all by themselves. 3, they can swallow the food. Babies who are not ready will push the food back out, so they get more around their face than they do in their mouths. Why is it important to wait until baby is ready to start solid foods? We know babies can get all the nutrients they need from breast milk or correctly made up first stage infant formula until they're around 6 months old, 26 weeks. From 6 months, a baby's digestive system and kidneys are developed and can cope fully with the solid foods. Babies weaned too early may develop allergies and intolerances to some foods. Starting solids early is linked to higher risks of obesity. Research has shown that infants given solids before 4 months are often heavier at 7 and 14 months. Waiting until baby is developmentally ready for the food will mean your baby will be interested and adjust to eating new foods more easily. This will make it more enjoyable for both you and your baby. There are some signs that are often mistaken for a baby being ready to start solid foods, and that's chewing their fists, waking in the night, wanting extra milk feeds, or we sometimes hear people say big babies need solids early. But these are normal baby behaviours and not necessarily a sign of hunger nor being ready to start solid food. Starting solid food will not make them any more likely to sleep through. A little extra milk should be all that's needed until they're developmentally ready for the food. If you are concerned your baby may be hungry or wakes more often, or you have any queries around baby's development, then please contact your health visitor who can support and advise. We know that first tastes are more about your baby getting used to the idea of meals and eating, so make sure that baby's not too hungry or too tired. Try when they're at their most playful and will be interested in trying something new. Remember, this is a new game for them. You are their best teacher, so it's important that you have the time to with baby to make sure the experience with food is not rushed but enjoyable. From the beginning, let baby touch and feel the food. Just squashing it in their fingers and smelling the food is all learning about food. We know that babies from 6 months put things in their mouth, so they may even lick the food too. If baby's not interested, just wait until the next time. There really is no reason to rush. Encourage baby to feed themselves using their own fingers as soon as they show an interest. If using a spoon, wait until baby opens their mouth before you offer the food. Allow baby to hold the spoon too. Always check food is not too hot. Allow it to cool and test it before giving it to your baby. Start by offering just a few pieces or teaspoons of food just once a day. Ensure baby sits up straight and always stay with baby when they're eating in case they choke. Your baby may gag to begin with as they're learning how to manage the amount of food they can chew and swallow at one time. Offering homemade food is best. Your baby might make funny faces when trying new tastes, but it doesn't mean that they don't like it. They're just getting used to a new taste or texture. It can take 10 tries or even more for your baby to get used to new foods. It's often a good idea to offer new foods alongside a familiar food, and with repeated exposure, your baby will get used to it in their own time. Every baby is different, and some may be slower than others when learning how to manage food. However, a range of smooth foods and soft finger foods can be offered at 6 months. Babies are born with a liking for sweet flavours, so it's a good idea to try more savoury vegetables first. Something like broccoli is ideal, as you can give your baby some pureed broccoli as well as a cooked broccoli florette. This way, right from the beginning, you are getting your baby used to different tastes and textures. Try vegetables one at a time to start with, as evidence suggests that babies introduced to single vegetable flavours are more accepting of vegetables in meals later on. Then try combinations of the different vegetables together. Vegetables are good as your baby can learn the skill of taking the food in, moving the food around their mouth, and swallowing. You can use potato or sweet potato to thicken, smooth, or mashed vegetables if needed. Full-fat cow's milk, breast milk, or formula can also be added if you want to adjust the consistency too. However, these are often not needed when only offering vegetables. Gradually, you'll be able to increase the amount and variety of food your baby eats, including combinations of starchy food, full-fat dairy, protein, and fruits. Babies don't need 3 meals a day to start with. Remember, they're still getting most of their nutrition from milk at this stage. The amount of food can be gradually increased over the first few weeks, so continue to follow your baby's lead. Every baby will be different. Some babies will happily eat finger foods and mashed foods, whereas others may progress more slowly, preferring the smooth foods given on a spoon, alongside foods they can hold themselves. All of this is very usual. By being consistent, making meal times enjoyable, and sitting together as a family as soon as possible for meals, it will help your baby learn to become a more confident eater. Cow's milk can be used in cooking or mixed with food from 6 months, but should not be given as a main drink until a year old. The Department of Health does not recommend that babies move on to follow-on formula at 6 months of age, as there is no health-related advantages to this. Most experts agree that giving babies a combination of finger foods as well as foods given on a spoon, whether that be pureed or more lumpy, is a sensible way to start weaning. This means right from the beginning your baby will be learning about different foods and textures. Even when they're squashing foods in their hands, they're learning about food, and they are more likely to be interested in eating it. Finger foods are something that often parents feel anxious about, as they're concerned about choking and gagging. We will cover this a little later on. Babies need to learn how to manage food, and the only way to do this is with practice. The safest way to give finger foods is by ensuring they are soft and easy to bite and chew. Soft cooked vegetables or fruits are good things to start with. It can be useful to make the finger foods slightly bigger than the baby's hand, so they can grip them with their fist. The size of an adult finger is a good guide. Make sure finger foods do not contain any pips, stones, have tough skin, or stringy bits. It is best to avoid whole grapes or cherry tomatoes, as they are foods that babies are most likely to choke on. If offering raw food, ensure it is thoroughly washed. Babies should not be left alone at any time when they're eating, and carers should pay particular attention when babies are eating finger foods to make sure that babies don't choke on any pieces that are broken off in their mouth as they develop their eating skills. Cups can be introduced from 6 months and sips of water offered with meals. Tap water can be given to babies over the age of 6 months. However, any water given to babies under 6 months should be boiled or cooled first. If your baby was born early, wait until your baby is 6 months corrected age before giving tap water. Just like eating, a baby needs to learn the skill of drinking from a cup. It is best to use a cup that is either open-topped or which has a spout with holes so the water is free-flowing. Your baby will learn that when they tip the cup up, there is water. These will also help develop your baby's jaw development too. The anti-spill cups are good for us, but they make it more difficult for a baby to learn. There is no need for drinks other than breast milk, first-stage infant formula, or water in the first year. Baby juices are unnecessary as they contain sugar, so can damage a baby's teeth. You will have seen a range of products in the supermarkets that are marketed as baby foods. Evidence suggests that many baby food products are less nutritious, often sweeter, and are of a different consistency compared to homemade equivalents. You can see the differences easily in these pictures between the commercially made and homemade foods. The shop-bought food looks a lot smoother. Look at the colours too, which looks more interesting and appetizing to you. It is likely that most infants manage a faster progression through the textures if using homemade family foods. Shop-bought products are often swallowed rapidly too, leading to baby eating more than they actually need. These commercially made products do not promote the chewing and swallowing that babies need to become more confident eaters. You will have probably seen in the supermarkets the pouches. If using baby food pouches, we do not recommend that a baby sucks food directly from the pouch, and that's because it does not encourage the learning of and use of chewing skills. Babies are unable to distinguish what they are eating and cannot see or smell the food as easily. Children who are given smooth foods in pouches for longer periods may become fussy eaters later on. Children develop fine motor skills when picking up food or playing with it. Pureed food and vegetables in pouches are high in free sugars, and sucking these foods may contribute to tooth decay. There is no portion control if food is eaten directly from the pouch, so there may be considerable food waste. Be aware when using commercially made baby foods that you are paying a high price for convenience, and many of the foods are poor value for money when considering the ingredients used at home. By 7 to 9 months, your baby may be eating 3 meals a day, alongside their usual breast milk or first-stage infant formula. Meals can now be mashed or with soft lumps, and babies will be enjoying having finger foods with meals, holding a spoon even if they cannot yet feed themselves, and being included at mealtimes with other people. You can progress quite quickly through the different textures. From 10 to 12 months, lunches and dinners can include a main course and a pudding. Something like fruit or unsweetened yogurt is ideal. Baby will be enjoying meals which are chopped with bigger, softer lumps and can manage a wider range of finger foods, and will become increasingly dexterous in their ability to pick up small pieces of food, move them to their mouth. They'll be using a cup with confidence too. As time goes on and your baby eats more solids, they will want less breast milk or infant formula. Remember, your baby's tummy is tiny and fills up quickly, so offer milk feeds after solids. Babies under 12 months don't need snacks. If you think your baby is hungry between meals, offer extra milk feeds instead. By a year old, breast milk or infant formula will provide less energy and nutrients than the food your baby eats, and babies will move on to having 3 meals, chopped if required, as well as 2 nutritious snacks. Breast milk still does provide energy and nutrients and protection from infection to babies for as long as they're breastfed. Babies should be eating a wide range of foods at meals, showing increasing independence in eating, and using a cup for any drinks other than breast milk. Full-fat cow's milk and full-fat dairy products should be given to children under 2 years, as they need the extra fat and vitamins in full-fat dairy products. Breast milk should be encouraged for as long as both mum and baby want to do it. You can give your child unsweetened calcium-fortified milk alternatives, such as soya, almond, or oat drinks, from the age of 1 and as part of a healthy, balanced diet. However, babies and children under the age of 5 shouldn't have rice drinks or rice milk. If your child has an allergy or an intolerance to milk, you can talk to your health visitor or GP and they can advise on a suitable milk alternative. There are some foods to avoid. Salt and salty food. Babies should not eat much salt as it's not good for their kidneys. Do not add salt to your baby's food or to cooking water. Avoid stock cubes or gravy as they often are high in salt. Remember this when cooking for the family if you plan to give the same food to your baby. Avoid salty foods like bacon, sausages, chips with added salt, crackers, crisps, ready meals, and takeaways. Sugar. Your baby does not need sugar, so avoid anything sweet or sugary. By avoiding sugary snacks and drinks, including fruit juices and other fruit drinks, you'll help prevent tooth decay too. Saturated fat. Do not give your child too many foods that are high in saturated fat, such as crisps, biscuits, and cakes. Checking the nutrition labels can help you choose foods that are lower in saturated fat. Honey. Honey should be completely avoided until your baby is over a year old. This is because it occasionally contains bacteria that can make your baby seriously unwell. Honey is also a sugar, so avoiding it will also help prevent tooth decay. Whole nuts and peanuts. Whole nuts and peanuts should not be given to children under the age of 5 years, as they can choke on them. You can give your baby nuts and peanuts from around 6 months old, as long as they're crushed, ground, or a smooth peanut butter. If there's a history of food allergies or other allergies in your family, talk to the GP or health visitor first before introducing nuts and peanuts if needed. Some cheeses. Cheeses can form part of a healthy, balanced diet for babies and young children and provides calcium and protein and vitamins. Babies can eat pasteurized full-fat cheese from 6 months old. This includes hard cheeses such as mild cheddar cheese, cottage cheese, and cream cheese. Always check labels on cheeses to make sure that they're made from pasteurized milk. Babies and children should not eat mold-ripened soft cheese such as brie or camembert, or ripened goat's cheese, and soft blue vein cheese such as Roquefort. This is because they are higher risk of these cheeses that might carry a bacteria called Listeria. Many cheeses are made from unpasteurized milk. It's better to avoid these because of the risk of Listeria. But these cheeses can be used as part of a cooked recipe as Listeria is killed by cooking. Making brie, for example, is a safer option. Raw and lightly cooked eggs. Babies can have eggs from around 6 months old. If the eggs are hen's eggs and they have a red line stamped on them, or if you see a red line with the words British Line Quality on the box, it's fine for your baby to have them raw, for example in a homemade mayonnaise, or even lightly cooked. Hen's eggs that do not have the red line stamp should be cooked until both the white and the yolk are solid. This is also the same for duck, goose, or quail eggs. Avoid raw eggs, including uncooked cake mixture, homemade ice creams, homemade mayonnaise, or desserts that contain uncooked egg that you cannot confirm has the red line stamp. Avoid raw jelly cubes. Raw jelly cubes can be choking hazard for babies and young children. If you're making jelly from raw jelly cubes, make sure you always follow the manufacturer's instructions. Raw shellfish. Raw or lightly cooked shellfish such as mussels, clams, and oysters can increase the risk of food poisoning, so it's best not to give them to babies. Shark, swordfish, or marlin. Do not give your baby shark, swordfish, or marlin, as these fish contain mercury, which can affect the baby's growing nervous system. Avoid foods with E numbers and additives. Foods such as cereal or rush should never be added to a baby's bottle, as this can cause choking and confuse a baby's appetite. There are also some drinks to avoid. Fruit juices, smoothies, squash, fizzy drinks, and flavoured milk all contain lots of sugar, even if they're diluted, and these can cause tooth decay. Diet or reduced sugar drinks are not recommended for babies and toddlers either, as they can fill them up and they will be less inclined to eat nutritious food. Tea and coffee should not be given to babies as the caffeine and tannins can interfere with iron absorption, essential for growth. Rice milk and rice drinks. Children under 5 years old should not have rice drinks as a substitute for breast milk or infant formula, or for cow's milk after a year old, as they may contain too much arsenic. Arsenic is found naturally in the environment and can find its way into our food and water. Rice tends to take up more arsenic than other grains, but this does not mean that you or your baby cannot eat rice. In the UK, there are maximum levels of inorganic arsenic allowed in rice and rice products, and even stricter levels are set for foods intended for young children. Do not worry if your child has already had rice drinks. There's no immediate risk to them, but it's best to switch to a different kind of milk. Slush ice drinks. Children aged 4 years and under should not have slush ice drinks, sometimes known as slushies, as they may contain too much glycerol. Glycerol is used instead of sugar to create the slush effect. Young children who have too much glycerol may develop a headache or feel sick. It can cause symptoms such as feeling dizzy, low blood pressure, confusion, and they can even pass out. Cow's milk does not have the right balance of nutrients for babies, so should not be given as a drink before 12 months old. However, small amounts can be used in cooking. Follow-on formula, growing up milks, and good night milks are not suitable for babies under 6 months and are unnecessary after 6 months. Unsweetened calcium-fortified plant-based drinks such as soya, oat, and almond drinks should be avoided before the baby is 12 months old. Choking versus gagging. There is a difference between choking and gagging. Gagging is a normal reflex as your baby learns to chew and swallow solid foods. Gagging is loud. Your child's skin may look red when they're gagging, but redness can be harder to see on brown or black skin. Your baby may gag when first introduced to solid foods. This is very normal. This is because they are learning how to regulate the amount of food they can chew and swallow at one time. They will eventually learn to cope with the different tastes, textures, and harder foods. If your baby is gagging, this is what may happen. Your baby's eyes may water. They might push their tongue forward or even out of their mouth. They might make a retching movement, bringing the food back up, or they may even vomit. Choking is quiet. If your child has white skin, it may begin to look blue when they're choking. If they have brown or black skin, their gums, inside their lips, or even their fingernails may begin to look blue. Remember, you should always stay with your baby when they are eating in case they choke. If you think your child is choking and cannot breathe properly, but is still conscious, get them out of the high chair, support their chest and chin with one hand, ensuring that their head is lower than their bottom, and give up to 5 sharp blows between the shoulder blades with the heel of the other hand. Check between each one in case the item has become dislodged. If back blows do not relieve the choking and your baby is still conscious, then give up to 5 chest thrusts. To perform chest thrusts, lay your baby face up along the length of your thigh, still supporting their head. Place 2 fingers in the middle of their chest and give 5 sharp chest thrusts. This is compressing the chest by about a third. If the object still isn't dislodged and your child is still conscious, continue the sequence of back blows and chest thrusts. Don't ever leave the child. Call 999 if the blockage doesn't come out after trying back blows and chest thrusts. Keep trying this cycle until help arrives. Even if the object has come out, seek medical help, as part of the object might have been left behind, or your child might have been hurt by the procedure. If your child is not responding, not breathing, or becomes unconscious at any point, then you would need to call 999 immediately. Put your phone on speaker so you're hands-free and able to perform CPR. The call handler will talk you through what is needed to do. Failing that, learn how to deal with choking by visiting www.nhs.uk/choking-baby, or even better, look in your local area to find a baby and child first aid course. The British Red Cross also has a baby and child first aid app. You can download this and it is really helpful in the event of anything happening. There is also the choking and gagging videos on this app. You can introduce cow's milk, eggs, wheat, gluten, nuts, peanut products, seeds, fish, and shellfish after 6 months. Make sure you offer them one at a time and in very small amounts. It is a good idea to offer these earlier in the day so it's easier to gain help if required. Once eaten, leave several days between trying a new allergen food, so that it's easier to identify any food that has caused a reaction. An allergic reaction usually happens quickly within a few minutes of exposure to the allergen. Signs of allergy include a runny nose, a skin reaction such as blotchy raised red rash or itchy patches, stomach upset, so loose stools which may contain mucus, sore, red and itchy eyes. If any symptoms are observed, talk to the GP for advice or call NHS Direct on 111, and that's for non-urgent medical inquiries. In more severe cases where swelling around the mouth or breathing difficulties can occur, if your baby is suffering a severe reaction, call 999 and do not delay. Once introduced and if tolerated, keep offering these foods as part of baby's usual diet. This helps minimize the risk of allergies moving forward. Evidence has shown that delaying the introduction of peanuts and hen's eggs may increase the risk of developing an allergy to these foods. Eggs without a red line stamp should not be eaten raw or lightly cooked. If your baby already has a known allergy, for example a diagnosed food allergy or eczema, you may or be under the care of the paediatrician or dietitian who will support you with introducing solids. If you have a family history of food allergies, eczema, asthma or hay fever, then care should be taken when introducing peanuts and peanut products. Talk to your GP or health visitor first if required. Remember, peanuts, nuts and seeds should be crushed or ground for children under the age of 5. Providing different healthy foods from the beginning can reduce fussiness later in life. Babies should have mum's milk or first stage infant formula for at least the first year and can carry on with mum's milk for as long as both wanted. Allow plenty of time for eating, go at baby's pace and do not force feed. Babies can take their time getting used to different foods, so offer a small amount numerous times to get them used to them. Doing this alongside a familiar food is often best. Self-feeding can be messy, but it's an important part of baby's development and allows them to show you how much they actually want. Signs of hunger may include leaning towards or grabbing food and opening their mouth. Be attentive to your baby, focus on their body language as this will show whether they're still hungry or whether they're full and ready to stop. By responding to what baby is telling you, it helps to avoid encouraging them to eat more than they need. Signs that baby is full or had enough could be firmly closing their mouth or turning the head away. If you're using a spoon, wait for your baby to open the mouth before you offer the food. Do not force your baby to eat. Wait until the next time if they're not interested this time. It is normal for a baby to reduce milk intake or even drop a milk feed as more solids are eaten. Talk to your baby, interact, and make meal times a social time. Babies copy their parents and other children, so eat together as a family as soon as possible. Don't worry if baby hasn't eaten much in a meal or even in a day. What they eat over a week is more important. Be guided by your baby and their appetite as they're growing and developing in the first year. Try to stay relaxed and calm, and remember, homemade is best. A baby's immune system is not as strong and developed as an adult, so they're more vulnerable to infection and bugs such as food poisoning. It's important to take extra care with hygiene and preparing food safely. Always wash and dry your hands well before preparing your baby's food. Make sure baby's hands are clean too, especially if they're feeding themselves with finger foods. Clean all surfaces before preparing or eating food, especially chopping boards with hot soapy water. Keep pets away from food preparation surfaces. Thoroughly wash and dry all bowls and spoons for feeding in hot soapy water. You do not need to sterilize bowls and spoons, but you must continue to sterilize bottles and teats until baby is a year old if you are using these. Clean and disinfect your baby's high chair and bib after each meal. Tea towels, kitchen cloths and sponges can harbour lots of germs, so wash or change them regularly. Wash and peel fruit and vegetables. Keep raw meat and eggs covered and away from other foods in the fridge, including cooked or ready-to-eat meats. Raw meat should ideally be kept in a sealed container at the bottom of the fridge, so it can't touch or drip onto other foods. Avoid raw eggs and raw shellfish. When storing food, if you're batch cooking, cool the food down, ideally within 1 to 2 hours, and then freeze or refrigerate. If you're keeping it in the fridge, use it within 2 days. With rice, make sure it cools within the hour and then go straight into the fridge or freezer. Rice kept in the fridge should be eaten within 24 hours. Never reheat it more than once. Boiling the bag rice should not be kept or reheated at all. Defrosting frozen food, do this thoroughly before reheating. The safest way to do this is in the fridge or by defrosting it in the microwave using the defrost setting. Never leave food out to defrost at room temperature. Once food has been defrosted, eat it within 24 hours. When reheating, only ever reheat food once. When reheating food, make sure it's steaming hot all the way through, then let it cool before giving it to your baby. If using a microwave, give it a good stir to get rid of any hot air pockets. Always check the temperature before feeding your baby. To cool food quickly, place the food in an airtight container and hold it under cold running water, stirring the contents from time to time to allow it to cool all the way through. Remember, never heat baby's milk in the microwave as it heats unevenly and can cause hot spots which can burn a baby's mouth. When taking food with you out on the go, such as sandwiches or yogurts, it's a good idea to use a cool bag with ice blocks, or even frozen bottles of water would work just as well. These will keep it cold until it's time to eat. If food is not kept cold, it should be eaten as soon as possible within 4 hours maximum. All children aged 6 months to 5 years should have vitamin supplements containing vitamins A, C, and D every day, even if they're eating a well-balanced diet. However, babies who are having more than 500 mils of infant formula a day should not be given the extra vitamin supplements because the formula is already fortified with these, as well as other nutrients. Babies who are being breastfed should be given a daily vitamin D supplement from birth, and that's as a precaution. This is whether or not you're taking the supplement containing vitamin D yourself. Healthy Start, as you see on these vitamins, is the name of the welfare food scheme in England, Wales, and Northern Ireland. This scheme aims to improve the health of pregnant women, young mums, and mums-to-be, as well as families on benefits or low incomes. You need to apply for this, and if eligible, Healthy Start provides a prepaid card with funds that are topped up every 4 weeks. The money can then be spent on fruit and vegetables, including pulses, cow's milk, or first stage infant formula. You can also get free vitamins on the scheme. Ask your health visitor for details if needed, or visit www.healthystart.nhs.uk. Oral health. It is important to protect your baby's teeth as soon as they start to have solid foods. Here are some ways you can do this. Continue to breastfeed, as evidence indicates that breastfeeding up to 12 months of age is associated with a decreased risk of dental caries and may offer some protection when compared with infant formula. Avoid foods or drinks that are high in sugar. Don't allow baby to suck food directly from a commercially made baby food pouch, as this may impact on oral health and affect their chewing skills too. Don't offer anything but breast milk, infant formula, or water in a bottle. Feeding from a bottle should be discouraged from the age of 1 year. Introduce a cup from 6 months and offer water with meals. Don't dip dummies in anything sweet or pacify children with sweet foods. The use of dummies should be discouraged by at least 12 months of age. Using dummies after this can encourage an open bite, which is when teeth move to make space for the dummy. It may also affect your child's speech development too. Parents or carers should start brushing their baby's teeth as soon as the first milk tooth breaks through the gum. Using a soft baby brush, brush teeth twice daily for about 2 minutes with a mild fluoride toothpaste containing no less than 1,000 parts per millionth of fluoride. Brush last thing at night, before bed, and on one other occasion during the day. Use only a smear of toothpaste approximately 3/4 of the way along the toothbrush. Make sure children don't eat or lick toothpaste from the tube. Getting babies into the habit of toothbrushing early is important. Whilst teething, you can give your baby the toothbrush without toothpaste on. This will make them more familiar with having the toothbrush in their mouth and encourage them for when they add the toothpaste once a tooth appears. Register with a dentist and visit regularly. This will help get babies and young children used to the environment. You don't need to stop breastfeeding just because you're returning to study or work. Many women find ways to continue breastfeeding their baby. Employers have certain obligations towards breastfeeding women. Look at maternityaction.org, the ACAS website, or the NHS Breastfeeding and Returning to Work leaflet. These are websites for further information about how to support you continuing your breastfeeding journey when returning to work or study. Even when you are no longer fully breastfeeding, 1 or 2 breastfeeds a day will still benefit yours and your baby's health. Giving your baby a breastfeed after a busy day helps you and your baby unwind. The World Health Organization recommends breastfeeding up to 2 years and beyond if you choose. The longer you breastfeed, the longer you share all the natural goodness with your baby. Following the session today, if you feel you need further support around introducing solids to your baby, then please do not hesitate to contact us on our single point of contact line 0300 303 0916. This is available during office hours. Also, on our Growing Healthy app, we have the Health Chat facility. This is a texting service that again is answered during office hours.
Please could you take the time to complete the short feedback form for today's workshop? Thank you. We as a team appreciate your honest answers, as this helps to improve our service for the future.